With so many options today, finding the right physical therapist can be difficult, but it really doesn't have to be. There are some key questions you can ask to really narrow your choices down. Today's local expert in physical therapy will share some insider tips on what to look for when searching for the right services.
I'm often asked, what exactly does a physical therapist do and how can it help? A physical therapist is an expert in improving mobility and motion. It could be something simple like having trouble reaching the top shelf in your kitchen because your shoulder hurts, or a person might have difficulty lifting their baby because of lower back pain. Sometimes it could be something more complex, like such as a gymnast who is having trouble arching her back far enough to do a proper bridge. Orthopedics is a specific area in medicine that focuses on the skeletal system, your bones, the joints and soft tissues, muscles, tendons, and ligaments. Many people ask me about chiropractic care and how it differs from physical therapy. Most people know of chiropractic care as the Rice Krispie treatment, snap, crackle, pop. What they actually do is emphasize the adjustment of the spine back to its proper alignment. Physical therapists, like me, will work hand in hand with chiropractors, either pre-adjustment to relieve muscle spasms and stretch tight muscles to allow for a better adjustment, or post-adjustment to stabilize the spine as well as to prevent future misalignments with strengthening. Now, there are some myths out there about physical therapy. The first is that we give massages. We don't. Please don't ask for one. There are no candles, no soft music playing in my clinic. A massage therapist will work on large portions of your body, usually with the intent on relaxing you and your muscles. I'm going to take the time to identify the specific muscle group that is tight and treat it with what is called soft tissue mobilization. This can involve pressure, stretching, contract relax techniques, all with the purpose of loosening up that one particular muscle. The second myth is that physical therapy will be painful. I've heard it all. PT stands for pain and torture. I'm a physical terrorist. I enjoy causing pain. Not true. I really don't enjoy making someone cry or squirm on the treatment table. But in most cases, patients come in with a painful injury, and at that point, everything is going to be uncomfortable. And I admit that stretching and working on an injured muscle or joint isn't always the most comfortable thing in the world. But my job is to relieve pain, not make it worse. The last myth is the general misconception that PT is just a glorified gym and that I'm going to throw a patient on the stationary bike or treadmill, walk away for 15 minutes, then tell them thanks, see you in a week. Therapeutic exercise is only one of many different treatment options that are available. Speaking of what's available, what does a physical therapist actually do? It all starts with the evaluation of the patient. Talking with the patient and performing tests will identify problem areas and what the patient needs. Then I can determine a specific treatment plan that addresses those needs and the patient's ultimate goals, whether it's walking the dogs in the morning without pain or performing back handsprings. Like I mentioned before, there are many options available to get us there. Manual therapy is where I use my hands to provide resistance, guidance, or to mobilize restricted joints or tight muscles. There are also what we call modalities, such as ultrasound, where sound waves are absorbed by the body's tissues, causing either a heating effect or to break up inflammation and scar tissue. Muscle stimulation can also stimulate healing as well as provide pain relief. Ice and heat are used to reduce inflammation and pain or to improve muscle flexibility. Therapeutic exercise, like I mentioned before, is always a part of treatment as well as patient education. This is the most important aspect of physical therapy treatment as far as I'm concerned. I need the patient to be comfortable in telling me what they're feeling and where they want to go, and I need to explain what I'm finding, what I'm working on, and how it's going to help the patient reach their goals. And I also need to teach the patient about their injuries in order to maintain what is gained, as well as how to prevent injuries from recurring. If we don't do that, our work is only half completed. My name is Robert Louie, and I'm a doctor of physical therapy and a board-certified orthopedic specialist. This is just a general picture of what I do as a physical therapist. My staff and I operate under the philosophy that we treat people, not problems. If you'd like to know more or have any other questions, please feel free to call me at 661-288-0022 or check out our website at www.unruhphysicaltherapy.com.
Incredible! What a huge impact a little time can make. With the right professional, the focus is simple. To find out more information, contact today's expert at the number on your screen. Thanks for watching.